I'd like to welcome everyone to this webinar on PRB's newest Engage presentation. Thank you for taking the time to participate. My name is Rachel Yavinsky. I'm a policy analyst with PRB, and I was actively involved with several of my colleagues at PRB in developing this presentation about the PHE approach that we're talking about today. We are also going to be joined by Jason Bremner, Director of Population, Health, and Environment at PRB. There are a few webinar logistics to note before we begin. First, there will be no audio interaction during this webinar. You will be able to hear the presenter, but we won't be able to hear you. If you would like to submit a question, please use the questions pane in your GoToWebinar control panel. Type in your question and click Send to submit it. You are welcome to submit questions at any time, though we will save them and respond to as many questions as possible during the Q&A portion at the end of the webinar. If you have any technical difficulties during the webinar, please submit a question and we will try to answer it immediately. My colleague, Taijen Sai, is standing by to help you troubleshoot if need be. If you are listening to this webinar on your telephone, we want to remind you that you will incur long-distance charges depending on your carrier, so we encourage you to listen to the webinar through your computer audio. If you have a mobile phone or other electronic handheld device, please move it away from your speakers, as it can affect your ability to hear the webinar. Finally, you might want to consider closing any other programs that are open on your computer, because they may interfere with the quality of your connection. If you are having trouble seeing or hearing the webinar, please let us know, but be aware that the problem may be due to the quality of your internet connection. So getting started, we'll begin with an overview of all of PRB's Engage presentations and what we mean by an Engage presentation, and then discuss the specific presentation we're sharing today, which is called Population, Health, and Environment Working Together. We'll show you the full presentation and then review the accompanying materials, such as how to download the presentation files and what is available in the user guide. Finally, we'll end with some time for me and Jason Bremner to respond to questions that arise. So to begin with, what are these Engage presentations? PRB's Engage presentations are dynamic multimedia presentations for policy communication about family planning and reproductive health issues. These presentations are designed to engage high-level leaders in critical conversations about family planning, reproductive health, and development. Through the presentations, complex research and data are distilled into simple messages and graphics, enabling leaders at all levels to grasp the evidence base for investment in health as a key development strategy. And finally, Engage presentations are intended to be useful advocacy tools, so they are available online for people like you to download and use as a part of their own work. The particular presentation we're focusing on today, Population, Health, and Environment Working Together, was developed with funding from the USAID Office of Population and Health through PRB's IDEA project, which is informing decision makers to act. Through this project, we aim to increase support among policy audiences for effective health and population programs around the world. The goal of Population, Health, and Environment Working Together is to explain how the PHE approach works to improve health, livelihoods, food security, and natural resources worldwide, highlight success stories from PHE projects around the world, foster discussion among audience members about the need for increased investment in integrated PHE projects. There are several target audiences for this presentation. The primary audience is government policymakers at all levels and development donors who are in a position to allocate resources and advance PHE on the policy and program agenda. Secondary audiences include all of those who influence high-level policymakers, news media, civic and religious leaders, program officials, and other community leaders. This presentation is a tool that you can use to reach any of those audiences with messages about the PHE approach. For example, you might use the presentation with a group of regional policymakers about the importance of investing in PHE in their region. Or you might use the presentation with family planning or environmental advocates to highlight how the PHE approach works for both men and women to improve lives and protect natural resources. As you watch the presentation, I'd like you to consider how you might use the presentation yourself as an advocacy or educational tool to reach a specific audience or group in your country. I'll go through the set of materials for this presentation in detail a little later in the webinar, but I do want to give a brief overview now. The presentation is available in two formats, both of which you can download from PRB's website. One is a narrated video, and that's what I'm about to show you during this webinar. The other format is a clickable presentation similar to PowerPoint, which you could stand up and deliver live to an audience. In addition to the presentation itself, we have a user guide available which provides instructions and support materials to use the presentation. So without further ado, here is Population, Health, and Environment Working Together, narrated by Dorcas Luanga.
Population, Health, and Environment Working Together. Integrated population, health, environment projects are improving the lives of women and families around the world. The lives of women like Rukia. Like many rural women, Rukia faces challenges providing for her family and keeping her family healthy. And diminishing natural resources are making this more difficult. Rukia lives in a small agricultural village in Tanzania, which borders Sadani National Park. For many generations, coastal families have been dependent on fishing for food and income. But overfishing and the use of unsustainable fishing methods now threaten this way of life. In the inland villages around Sadani National Park, poor farming practices and recurrent drought make it hard for farmers to make a living and feed their families. And the small amount of fertile land outside of the park must be divided among the growing number of families who want to grow crops, making many plots too small to support a household. After providing for the household's immediate needs, such as food, water, fuel, and childcare, women like Rukia often have little time or resources available to access health services for themselves or their children. Basic health services that many women want, such as maternal and child health services and access to family planning, are out of their reach. For women who want to delay or space their pregnancies or don't want to have any more children, lack of family planning programs can result in early childbearing, unintended pregnancies, and larger than desired family sizes. Communities are affected too. Large families mean that the local population has grown, and with it so have the demands on local resources, including land, fuel wood, building materials, and fish. These challenges that women like Rukia face are all connected, making it difficult to address any one of the problems alone. Health, livelihoods, food security, environment, and population are all important pieces of this puzzle. In response to these interrelated challenges, many organizations have developed integrated approaches that respond to the health, livelihood, and environment needs of communities. This approach is often called Population, Health, and Environment, or PHE. PHE initiatives use integrated approaches to improve access to health services, including voluntary family planning and reproductive health, while helping communities to manage natural resources and conserve the critical ecosystems on which they depend. The PHE approach has been tested by environmental and health organizations in diverse locations across multiple continents, and the dots on this map mark PHE projects conducted over the last several years. These projects have proven effective for improving the lives of people in a variety of ways. PHE projects often work with people beyond the reach of health systems in remote and hard-to-reach areas. They have proven to be more effective than single-sector efforts, saving organizations and communities time. They are often more responsive to people's priority needs, thus gaining greater community support. And they often lead to greater involvement of men in health and women in environment and livelihood aspects of projects. Let's travel around the world to 5 projects and see how select results illustrate the benefits of the PHE approach. In southwestern Madagascar, Blue Ventures, a conservation organization working with remote rural communities to protect marine areas, has helped health services reach previously inaccessible and underserved communities. The villages in this area are extremely isolated, and transportation and communication are great challenges. Blue Ventures began working on marine conservation in this area in 2003. promoting sustainable octopus fisheries, community-based aquaculture, and improved fishing practices. In the course of working closely with communities, Blue Ventures consistently heard from women about their health needs and in particular about the lack of availability of reproductive health services. At the same time, Blue Ventures, along with the community, worried about the long-term sustainability of their work in the face of the rapidly growing coastal population and the growing demand for marine resources. In response, Blue Ventures integrated health initiatives into their existing activities and established the area's first clinic providing women with a variety of health and family planning services. Recent data illustrate the high demand for services in this remote area. The graph shows that contraceptive use increased from only 10% before the project began to 55% by 2013. The Blue Ventures model of building on existing conservation programming to deliver health services allows both the health and conservation messages to reach a larger audience. This integration has also increased their conservation impacts. Through the clinics, the project has built stronger relationships with women and reached them with conservation messages and activities when before women were unlikely to attend local conservation meetings. This is important because women play a large role in the use of local resources and can be powerful partners for conserving them. In addition to increasing women's involvement in conservation, PHE projects have successfully increased men's involvement in family planning and reproductive health. In Ethiopia, the Gurage People's Self-Help Development Organization, known as GIPSIDO, integrated conservation and livelihood activities into the organization's reproductive health education and community-based family planning program. GIPSIDO compared results in their integrated PHE project area with an area where they were implementing only their reproductive health program. As the graph shows, husbands in the integrated PHE project areas were 4 times more likely to support use of family planning than husbands in the area which received only the reproductive health intervention. When men communicate with their wives and partners about using contraception or planning their next child, family planning use increases. In addition, the women in the integrated intervention areas were almost 4 times more likely to earn an income than the women in the reproductive health only areas, and more than 3 times more likely to use energy-saving stoves. Alternative income generation activities and energy-saving stoves can decrease both the economic and time burden on women, improving their health and leading to more participation in household and community decision-making. And with more time, income, and a manageable family size, families can invest in health, food, and education for each child, empowering the next generation. The population, health, and environment approach can be more efficient and effective than single-sector efforts. For example, in the Philippines, Path Foundation Philippines, or PFPI, has tested whether there are more improvements in both coastal resource management and reproductive health outcomes by delivering these services in an integrated manner as opposed to delivering either alone. Community-based distributors of family planning supplies shared integrated messages about reproductive health and environmental management, and youth volunteers and peer educators encouraged youth to be stewards of the environment and their sexual behaviors. In the PHE program site, youth were more likely to wait to have sex or, if sexually active, use contraception compared with a site with reproductive health messages only. PFPI's PHE interventions have also led to increases in food security of rural communities. The communities where PFPI works are dependent on coastal and marine resources as a source of food and livelihoods. So PFPI has focused their central theme on managing marine resources and assuring people's access to an affordable and sustainable supply of food from the sea. Results show a greater decrease in the proportion of households dependent on fishing in PHE communities than in the resource management-only communities. And the PHE communities showed more improvement in knowledge of the dangers of using cyanide and dynamite in fishing. Many environmental organizations have found that meeting priority needs of communities by including health and livelihood interventions with their conservation programs increases the support of local communities for biodiversity conservation. The Jane Goodall Institute, JGI, uses this approach in the villages around Gombe National Park in western Tanzania, where Jane Goodall first began her chimpanzee behavioral research more than 50 years ago. Over time, the forest around the park had been cut down and seriously degraded, largely due to an influx of refugees from neighboring countries. The population had grown more rapidly than the land and natural resources could support, placing increasing pressure on the resident endangered chimpanzees. JGI's community-centered conservation program initially focused on protecting chimpanzees and their habitat by establishing tree nurseries and creating woodlots to slow down the rate of trees being cut down around the park. As they worked with the local villagers, JGI staff learned more about the daily challenges facing the communities, including the desperate need for health and sanitation services. It became clear that long-lasting conservation could only be achieved by also addressing these more immediate needs. JGI was able to mobilize its existing networks to train community-based educators to provide HIV/AIDS prevention and treatment, family planning, counseling and education, and reproductive health services, reaching over 200,000 people with family planning messaging and resulting in over 9,000 people adopting a family planning method. By focusing on health and other livelihood needs, JGI has built trust and strong partnerships with the communities, leading to significant conservation gains, including more than 440,000 acres of community land set aside for conservation. We have highlighted just a few examples, but many PHE projects have demonstrated similar success in addressing complex and connected challenges related to population, health, livelihoods, food security, and environment. Back in her village in Tanzania, Rukia and her community have benefited greatly from the USAID-funded Pwani project, implemented by the University of Rhode Island's Coastal Resources Center. The Pwani project integrates population, health, and environment in the area where Rukia lives. As a peer educator, Rukia educates other community members about the connections between their health and the environment. She demonstrates and teaches women ways to generate sustainable sources of income, and she helps couples plan their families, choose the timing and spacing of their pregnancies, and have the number of children they want. Rukia has improved the health and economic prospects of herself, her family, and her community while protecting the environment upon which they all depend. We've seen examples of how communities are benefiting from the PHE approach. But these projects are reaching a relatively small number of the many families around the world facing these complex and interrelated challenges. Increased support and commitment from policymakers, implementers, funders, and local decision makers will ensure the sustainability and growth of the integrated PHE approach and will improve many more lives.
I hope you enjoyed the presentation. If you have questions about the content of the presentation, I'd be able to address those at the end of the webinar during the Q&A. So what you just saw was the narrated video of population, health, and environment working together. It is in the MP4 file format, which should play on most computer media players like Windows Media Player or QuickTime. The file is 290 megabytes, so it's a large file, and if you have a poor internet connection, it might be hard to download the file. The other format is the clickable presentation that you could deliver so that you could deliver the presentation live. This is in Flash and is a 58 megabyte file. This file functions very similarly to a PowerPoint in that you can use the forward arrow on your computer to advance one slide at a time as you deliver the presentation. The user guide includes the complete script for the presentation, so between the user guide and the presentation file, you have everything you need to give the presentation yourself. This format of presentation differs from PowerPoint, however, in that you are not able to edit or modify the presentation at all. You won't be able to add or remove slides, and you won't be able to change the content of each slide. If you would like to supplement the Engage presentation with a personalized PowerPoint presentation that fits the look of population, health, and environment working together, we have created a PowerPoint slide template. When you open the PowerPoint file, you can customize the white text in the center of the slide and add your organization or project logo to the top right corner. We encourage you to add text that is specific to population, health, and environment in your country, your PHE project, or ways that you would like your audience to support PHE. All of these materials can be downloaded from our website. In addition to the two formats of the presentation, we have a user guide to help you use the materials effectively. What you see here is our standard Engage user guide, which includes instructions relevant to all of PRB's Engage presentations. This includes an explanation of all the technology and file formats we're using, and instructions on how to set up both the narrated video presentation and clickable presentation. This user guide also includes overall guidance on delivering effective presentations and being a good presenter. Presentation Guide for Population, Health, and Environment Working Together contains the information a user would need specific to the content of this presentation. This is a separate document from the standard Engage presentation user guide, and both are available on PRB's website. In this user guide, we address presentation goals and intended audiences and uses. We include the script for the presentation if you want to deliver it yourself. We include a handout that you can use, questions for discussions with an audience, and a section on frequently asked questions, or FAQ. We also include the full references to the data sources used in the presentation and a listing of additional resources you may want to consult to learn more about the issues and research raised in the presentation. The user guide starts with an overview of the presentation goals. What you see here is a visual of the actual user guide, and this summarizes what I shared in the beginning of this webinar about the key messages in the presentation. I know you may not be able to read this text, but my goal is just to walk you through the user guide and let you know what is available. Under Opportunities to give the presentation, the guide summarizes the target audiences for the presentation and offers examples of how and why you might try to reach a selection of audiences with the messages in this presentation. The next part of the user guide is the presentation script. This is the complete script to narrate the presentation as you just heard it. What you see on the left is the presentation script just how it appears in the user guide. If you want to deliver this presentation live using the clickable presentation file, you can follow the script in your delivery. Click. You can see that this script is formatted with an arrow and the words click forward and a number. Every time you see that in the script, you would advance the presentation by one slide using your keyboard arrow and then read the text that follows. The numbers correspond to the slide numbers, which appear in the bottom right corner of the clickable presentation, so you can always confirm that you are reading the correct narration for each slide. So for example, right now we're looking at slide 2, and you would want to ensure that you are reading the narration for slide 2 in the script. So all you need to do to deliver this presentation yourself is to have the script in front of you and open the file on your computer. Then you click the forward arrow, read the script, and click forward to the next slide. And if you want to modify the script, revise the language to make it more comfortable for you, or add anecdotes or additional data about your country, you would of course be able to alter the script and do that for yourself. The next section of the user guide covers handouts. What you see here is the first page of a 6-page handout that is included in the user guide. You can photocopy or print copies of this handout to give to your audience if you use the presentation. The handout includes snapshots of the presentation visuals along with key concepts. In addition to this handout, the user guide includes instructions for creating a customized handout of relevant indicators using PRB's data finder. Creating a customized handout won't include the visuals and layout that you see here, but allows you to select data that is relevant to the presentation and specific to your country or context. This will help you connect the messages in the presentation with evidence relevant to your context for your audience. For example, for this presentation, you might use Data Finder to pull the population size, population projections, natural habitat remaining, and use of family planning among married women for your country. Next, in the user guide, we have a set of questions for discussion. After sharing the presentation with your audience, you would probably want to engage them in some discussion of the key issues raised. You may have ideas of your own questions, but the user guide offers some suggestions of questions you might ask to get the audience talking. For example, you might ask your audience for ideas on how population, health, and environment could be integrated in their own country setting. And of course, you can choose to ask your own questions of the audience instead. We also have a section on frequently asked questions and responses, or FAQ. After seeing the presentation, the audience may ask questions about the data, the concepts, or the issues. This section should help you to anticipate some of the more challenging questions the audience might ask, and offer suggestions on how you might respond. You can certainly choose to provide your own answers in your own way, but we hope that by reading this section in advance, you will feel confident to respond to any of the questions that arise. Finally, I'd like to draw your attention to PRB's Engage Snapshots. As I explained at the beginning of the webinar, our Engage presentations are multimedia tools for policy communication and advocacy around critical issues in family planning, reproductive health, and development. Population, health, and environment working together is one of these presentations, and others are available on topics such as youth, sexual, and reproductive health, family planning and poverty reduction, and family planning and gender. In addition to these presentations, we have a series of Engage presentation snapshots, which are short 2 to 4 minute multimedia videos. These are available on PRB's website only as narrated videos, but are much shorter and more focused than the larger presentations. I encourage you to view our Engage snapshot on the PHE approach, which can be downloaded in the same way as the full presentation and can be easily embedded to play as videos within a PowerPoint presentation. This makes them effective tools for enhancing your own presentations. If perhaps the full population, health, and environment working together presentation is not the right choice for a given audience or opportunity. And because they are so short, these videos are smaller file sizes, making them easier to download and stream, and are also easy to share online. As I wrap up this portion of the webinar, I want to remind you of the intended use of this presentation, Population, Health, and Environment Working Together. This is a multimedia advocacy tool that we hope advocates, educators, and others will be able to use in their work to help the key audience of high-level leaders and decision-makers to understand and support the concept of the PHE approach. As an advocacy tool, it is available on the PRB website, along with the user guide materials to help you share the presentation with audiences and spark policy dialogue about how the PHE approach works to improve health, livelihoods, food security, and natural resources worldwide. If you have any questions about the presentation materials, the presentation itself, or the content, or Engage materials in general, please go ahead and type them into the questions pane of your GoToWebinar control panel. We'll do our best to respond to all of the questions in the order they are received, but we apologize in advance if we're not able to get to them all in the time that we have remaining. If there are outstanding questions when we wrap up in 20 minutes, we'll try to respond to them in the future. So the first question's coming in: how can the PHE approach lead to greater involvement of men in health and women in environment and livelihood aspects of projects? PHE projects can increase participation of men and women in sectors outside of those they would traditionally be involved in. This can increase the impacts of the projects. Males who may initially get involved in the program through conservation and natural resource management activities then gain exposure to the health components of the program. On the other side, women and girls initially involved with health-focused activities become involved in natural resource management.
Hi, this is Jason Bremner, Program Director for Population, Health, and Environment at PRB, and I just happy to join you here and answer some of the questions that are coming in as well. One of the questions asked is, it seems many of the PhD projects are focused on rural areas of countries. Are there any urban projects? And thanks for that good question. Most of these projects, as you noted, are rural, and that's based on the fact that this approach has tended to work with communities and with households that are very dependent on natural resources. So most of the population health environment projects that we know of are working with these rural communities. Obviously, the urban households also have very integrated and connected issues and challenges that they face, and there are a lot of integrated projects that we know of, but we tended not to group these as population health environment projects. Just an example, for example, are some projects in Ethiopia that we know about where households that are facing challenges with HIV and AIDS are working on urban gardens and integrated with health aspects so that they can have better access to healthy foods and therefore better prepared to deal with the challenges of their disease. So those are urban gardening projects with people who are vulnerable. And we know of examples like that, but you don't see them represented here on the map.
So now we have a question about how the PHE approach can help conservation organizations to gain greater community support, which is one of the things that we talked about in the presentation. The PHE approach allows conservation organizations to build goodwill by addressing needs that are priorities for communities, and these often include health and livelihoods. Excuse me. Integrated projects are also better able to address priority needs because they're designed to target community concerns in multiple sectors as opposed to just one sector. In return, communities may be more willing to engage in natural resource management activities that they may not otherwise have been interested in.
Another question that often comes in that we're hearing is that how is this integrated approach more efficient than single sector projects, or is it more efficient? The single sector projects often work with the same community partners without coordinating efforts. So you might have a health project and a livelihoods project, two different organizations, or even sometimes the same organization implementing activities in the same community but not connecting with one another. So a single organization or multiple partner organizations carrying out a PHE integrated project can coordinate these efforts to prevent duplication and wasting of resources, as well as to promote interventions that have cross-sector benefits. Using combined teams of health and environment specialists instead of separate health and environment teams, and then hosting cross-sectoral events and trainings can reduce community fatigue that can occur when community leaders and members are asked to participate in multiple single sector activities. So although it's difficult to measure the results of these efficiencies, PHE practitioners report that integrated projects help them to use organizational and community time and resources more efficiently.
So we have a question now about whether there are plans to make this presentation available in other languages. As of now, Population Health and Environment Working Together is only available in English. However, the short version of the presentation, the snapshot that I discussed earlier, is going to be available in French, and that will be up on the website in the next couple weeks. Many of our presentations are available in English, French, as well as local languages. For example, our Senegal presentation is available in Wolof, French, and English. Our Malawi presentation is available in Chichewa.
I have a question coming in here on, is there population level evidence to show that family planning improves food security? And how well is this working to gain additional support for family planning from a broader base of supporters? I'm not aware of evidence at a population level that family planning actually improves food security, since food security is a complex concept that's affected by food availability, income, as well as population. What we do know is that at a household level, there is evidence that access to family planning is an important factor in income generation, women's workforce participation, women's health, and those are all importantly linked to many of the factors that affect food security. So at a household level, we definitely see evidence of these connections.
So we have a question about why there aren't more PHE projects and what are the limitations to PHE projects. Population health and environment challenges are connected in communities around the world, but they haven't often been connected where projects begin. Many of the donors who fund development projects are either focused in one sector or have divisions for sector-specific funding. Additionally, professionals who plan and run projects are traditionally trained in specific disciplines. Governments have separate departments or ministries responsible for population, gender, health, and environment. Encouraging donors, government decision makers, and program planners to support integrated projects and form cross-sectoral partnerships can help spread the PHE approach to more communities. And that's in terms of integrating PHE projects, but also in terms of doing cross-sectoral research and gathering more data on the connections between population, health, and environment.
Thanks. I have another question here on whether PRB works on addressing urban population issues. Although we don't talk about urban projects within this presentation, we certainly produce a lot of information on urban-rural differentials in poverty, in vulnerability to natural hazards, as well as health differentials. So while you don't see these particular integrated projects, which by the way are not implemented specifically by PRB, but by partner organizations, while you don't see them represented here, we certainly do a lot of work on analyzing and assessing issues in the urban environment. And I think that there's a lot of great analysis that you can find on PRB's website related to urbanization. An additional question here is whether or not there's enough evidence to address these population health environment issues, or whether further research is needed. There's certainly lots of opportunities to do research on the PHE integrated approach, and we've been encouraging connections between academic community and researchers and PHE projects that are still in some places struggling to measure the efficiencies of an integrated approach. Certainly there's lots of room for research on population environment connections, and there's a journal, in fact, called Population Environment that's a good collection of that research, and there's always room for additional research. We had a question here on what things are commonly found to prevent the PHE approach to work well. In addition to the challenges that Rachel just mentioned in terms of support and funding and some of the sectoral challenges, there are still challenges in capacity among organizations and individuals to do this work, and it's not easy for an organization that is focused on health to broaden their perspective and automatically have the skills that they need to integrate new components on livelihoods and environment into their work. So one of the things that we've been focused on the last several years is building capacity and building partnerships. We have some great examples of projects where health and environment partners are coming together to combine their skills so that they don't have the steep learning curve that comes with learning a new sector of work. So capacity is still a challenge, and it's something that we continue to try to overcome.
We have the question about other PHE projects in addition to the ones that we highlighted in this presentation. The projects shown in this presentation were selected to illustrate the benefits of the PHE approach, but there are many other PHE projects around the world. PRB runs a PHE map, and you can visit that to learn more about these projects. I don't have the link up here, but if you Google PHE map, it will come up. It's a Google map. And you can also, there's a link to this map in the presenter guide. The PHE project map was created by the Population Reference Bureau to visually identify and describe current and recent efforts focused on PHE integration in developing countries. The highlighted projects actively address a component of population and reproductive health in combination with environmental projects and programs. Projects that ended before 2005 are included, and the map might not be a comprehensive list of all projects, but if you have a project to add to the PHE map that isn't on there, please contact me at ruvinsky@prb.org. That email address we'll put up at the end of the presentation.
A great question here, which is, do you have a sense of the approximate current global magnitude of PHE investments, at least among major donors? That's a great question, and it's something that we don't have an exact number for. One of the reasons is that not all donors and not all projects explicitly call what they are funding population, health, and environment. Or some organizations are combining funds from two separate donors to actually implement an integrated approach. For example, an organization like Blue Ventures might get population and health money from UNFPA and conservation money from the Packard Foundation, and they're implementing a very integrated approach. They call it population, health, and environment, but the donor isn't explicitly funding population, health, and environment. But I can say that in terms of funds that are explicitly acknowledging these connections and funding an integrated approach, we're probably talking in the tens of millions of dollars. So somewhere between $10 and $20 million would probably be the total for all of these projects. So it's a relatively small number when you consider the overall investments in certainly in global health. So the one additional question here, and I apologize, I'm having to read these as they come in, is that integration of projects across sectors is a good idea, but there's competition for funds among international NGOs and a felt need for ownership from local agencies, NGOs. How can donors reduce this conflict to encourage cooperative, integrated approaches? It's a great question, and one of the things that has really happened within the community of population health and environment projects is we've seen a shift from international NGOs being the primary implementers of this approach to really local NGOs in several of the countries that we noted here, being implementers, while international NGOs are supportive in building capacity and providing technical assistance. Because as I noted, there's still low capacity for implementing this type of integrated approach. So that has been the shift over the last 5 years, and I think it's been very productive. It's building local capacity, and it's really led to a lot more projects over time, and it's meant that resources from international NGOs can be focused on spreading their resources across many organizations rather than focusing on a single site and investing heavily there. Additional good question on funding is who are currently the biggest funders of population health environment projects. Currently, the biggest funders are probably USAID and the Packard Foundation. Various offices within USAID have been supporting this approach. So while there's USAID's Office of Population and Reproductive Health, you also have different offices, for example, in the Philippines and in Tanzania, offices that are related to environment and economic growth have funded environment portions of this work, and then the offices of health have added in their funds. So in some ways you could think of those as separate donors coming together. The MacArthur Foundation has recently entered into funding some of this work around the Lake Victoria Basin, as has USAID's East Africa Regional Office. Apart from that, there are a lot of European donors who are not explicitly calling their funding population health and environment, but they are supporting this work. And CEDA is one over time that has funded several projects like this and is an important donor, but we don't have a sense of the magnitude of that investment.
So that's about all the time that we have available. So to wrap up, I want to thank all of you for taking the time to participate in this webinar. We did record this webinar, so we will follow up with you in a few days to provide a link to the recorded webinar, and that will include the key links that you see here so that you can go ahead and access all of the materials that we discussed today. If you do use any of these materials, we would love to hear about it. You can contact me directly at ryavinsky@prb.org, and I would love to know how you used the materials, what the outcome was, and how we can better support your work with data and materials about family planning and reproductive health. Before we end, I'd like to acknowledge my colleague, Jason Bremner, who worked on developing this presentation with me here at PRB, and I'd also like to acknowledge Taijen Sai and Angela Farmer of PRB, who played a key role in producing this webinar and making all of the materials accessible. That concludes our webinar. Thank you.
Thank you so much.